The main aim of this video presentation is to teach the postgraduates and trainees how to safely implant a non-foldable rigid lens in the bag during phacoemulsification surgery. As we all know that the modern world is moving towards phaco-refractive cataract surgery with use of premium intraocular lens, but there are still certain situations where non-foldable rigid lenses are preferred. As in the case of developing countries like India, it helps in minimizing the overall cost of surgery. In surgical camps, where limited resources are available, they prove to be a valuable alternative over the premium lenses. Training of postgraduates, which involves a step-by-step approach to cataract surgeries. They are usually given non-foldable rigid lenses in the initial period of their training program. There are two types of posterior chamber rigid lenses available. For phacoemulsification, the lenses have an optic size 5.25 mm and optic haptic length of 12 mm, which is considerably smaller than the one used in small incision or extracapsular surgery. Hence, these rigid lenses used during phacoemulsification remain highly unstable if placed in sulcus due to their overall shorter length. Complications that can arise while using non-foldable lenses. Intraoperatively, one may encounter posterior capsular rupture or zonular dialysis due to improper dialing technique. Late post-operative complication due to sulcus placement of rigid lenses may result in posterior capsular opacification, lens decentration, optic capture, iritis, raised intraocular pressure, and Irvin gas syndrome. In order to avoid such complications, we need to know the proper steps to ensure in the bag implantation. Plan A, McPherson forceps technique. Insert viscoelastics to inflate the bag in anterior chamber. Now bring the focus of microscope on the capsulorrhexis margin before proceeding to further steps. With the help of iris repositor or the spatula, direct the leading inferior haptic in the bag. This step can be compared to seesaw, where the function of fulcrum is done by iris repositor. Now hold the trailing haptic tip with the McPherson forceps and direct it in the bag. It is important to have a gentle and a constant grip. Release the grip once the maximum mark of haptic loop is below the rhexis margin. Confirm that lens is in the bag by focusing the microscope at the rhexis margin. What if this fails? Is there any alternative plan? So let's learn Plan B. IOL dialing technique. First step is to hook the optic haptic edge with the dialer and then to center the lens in the direction of the dialing. Second step is to tilt the dialer over the lens and have a downward directional force. Release the grip only when the maximum mark of the haptic loop is beneath the rhexis margin. Let's pause here. We can see the stretch in the rhexis margin once the maximum mark of haptic loop is beneath it. Let's replay this crucial step. Now let's learn Plan C. How to hook the haptic loop. First, insert the trailing haptic in the bag with the help of McPherson forceps. Here, with the help of dialer, we hook the haptic loop at the maximum mark. and bend it towards the optic. Once the loop bends sufficiently, direct it downwards and release the grip beneath the rhexis margin. Thank you for watchful listening.